Hi, everybody. Good evening. Great to be here amongst friends and family. Thank you, truly. It is an honor to be here amongst fellow physicians, public health leaders, and advocates for a healthier, fairer world. Listen, the work of this entity, the Washington Physicians for Social Responsibility, which I just, over the last few years, have had a chance to get to know better. We actually had quite a partnership during the 2024 election with the Climate Commitment Act and the No on 2117 campaign, so thank you enough. Can't thank this organization enough for your leadership and your trust in really talking about climate through the lens of health. It was an amazing framework for what I think we can do across the country. But the work of this organization has never been more urgent. Look, you have long understood what many are now only beginning to grasp, that health is inseparable from a just, free, and fair, civilized society. From clean air to common sense vaccinations for our children, from equitable care for all. You know, I look at what's happening with Medicaid. I know all of you are seeing what's happening. I mean, this is an exhausting news cycle, seemingly endless medical crises. I was saying this to my colleagues, Sarah and Lisa, here at Table 2 from Virginia Mason, that it is exhausting to keep up, and you often don't know what you should respond to and what you shouldn't respond to. But from equitable care for all to Tylenol use in pregnancy, from climate resilience to systemic fairness, the path to a healthier future is not paved in labs and hospitals alone. It is built through conscience, community, and courage. These happen to be the core ingredients of what make this organization so special, and they continue to power all that each of you do every day so impactfully. Tonight I want to talk about two pressing challenges that we as healthcare providers and as citizens must confront together. And I want to ground those challenges in facts, in stories, and in the reality of the people that we serve every single day. Let's begin with the air that we breathe, quite literally. You know, as Ken mentioned, I am on the board of the American Lung Association. And that organization, very poignantly, has as its tagline, if you can't breathe, nothing else matters. You know, we saw that reality play out just this week in Seattle. Here in the Pacific Northwest, wildfire seasons are longer, they're hotter, they're deadlier. Smoke now lingers in our lungs, the way it once lingered only in distant forests. From 2006 to 2020, wildfire smoke contributed to over 15,000 premature deaths, according to a study in Nature Communications. The economic cost, since we like to talk dollars and cents apparently when it comes to health justice, $160 billion. A public health burden borne not just in dollars alone, but in irreversible damage to lives and lungs. You know, those numbers are just the surface. When wildfire smoke drifts into Seattle, Spokane, and Portland, who suffers the most? It's people with asthma or COPD. The 5-year-old whose inhaler prescription ran out and they can't afford it. The pregnant mom in her first trimester. The construction worker who can't afford a day off. The family without an air purifier. Living and housing built long before modern ventilation standards. Based on the numbers you look at, exposure to chronic air pollution, and a shout out to the Global Burden of Disease folks over at the Institute for Health Metrics and Evaluation. They do incredible work at the University of Washington, IHME. Want to make sure that we shout them out. They have mapped the exposure of chronic air pollution across the world. Here in our urban city areas, in places exposed to wildfire smoke, across the United States. And what have they shown? They've shown very clearly that over just the last 7 years, exposure to chronic air pollution is now the 5th leading risk factor independently for death and disability worldwide. It's the 5th leading risk factor independently for death and disability worldwide, more so than any infectious disease, more so than obesity, frankly, that is surprising, and right behind high blood pressure. This is where climate justice becomes clinical. This is where public health and environmental health are one and the same. We must do more than acknowledge the threat. We need to act through the following: reaffirming state-based action on greenhouse gas emissions, targets in the total absence of the Environmental Protection Agency, especially recently being gutted, being completely neutered, we need to follow the leads of governors like Governor Gavin Newsom in California. We need to follow the lead of former Governor Jay Inslee, our current governor, Bob Ferguson, who I know is doing more and more in this space. We have to follow their lead. We need to enforce our quality standards across the board and ensure school districts have the necessary resources to scale the transition from diesel to electric school buses. Why does that matter? We talked about this so much during the No on the 2117 campaign, but we know that exposure to diesel exhaust from our school buses is a major risk factor for the development of childhood asthma. It was frankly, I see Mark here in one of the front tables, it was one, and Mark, I think you'll remember this, it was one of those statistics that when we talked about, people nodded their head. Now remember Labor Day 2024, the No campaign, so to vote down the Climate Commitment Act, before we really ramped up climate health messaging, was actually, polling was showing that it was actually going to get defeated, that it was going to be repealed. And what did? We started talking about electric school buses, the diesel to electric transition, educating the public. Not in a paternalistic way that we have to educate them and force-feed them information, but just giving them awareness on why these things matter. And I think a lot of people didn't realize that. Frankly, I didn't realize that before I was actually given the statistic that there is childhood asthma and the development that diesel school buses is such a risk factor. So we need to enforce those air quality standards. We need to expand mitigation efforts in forests nationwide to improve and mitigate the risk of wildfire smoke. I know this organization talks a lot about that. We have to bolster funding for HVAC improvements in schools and public spaces across the country and talk about it in ways that I think will not cause people to reflex and resist it, thinking that, oh, this is going to be more taxes. That was what the opposition said to us throughout the 2117 campaign, to protect it, that we were going to raise their taxes. And we weren't. That was the thing. We were not going to raise their taxes, but what did? We talked about health and the impact of a changing environment on human health, and especially their children's health. Incredibly, incredibly important. We have to train clinicians to better recognize and treat climate-related conditions. And I think finally, and more importantly, we have to make sure that we're training the next generation of climate activists to talk in persuasive terms about the ways the environment is changing around us and really emphasizing health impacts. I keep coming back to what we did in 2024 for a reason, because it was so darn effective. And it's been shown time and time again. And I know that many of you already know this, you don't need me to say this, that people receive this. If they're not going to agree with all of us in our politics in this room today, people generally, a majority of Americans will receive a message that's focused on their health and their child's health, more so than any other message when it comes to climate. We have to make sure that we're training the next generation accordingly to speak in those terms. And I just want to say, to emphasize this, Washington Physicians for Social Responsibility, we're here to support this organization today. And I said this to Ken earlier, without WPSR, if I'm saying that right, the acronym, without this organization, we didn't have the mobilization. We would not have had the mobilization of the healthcare community for the No campaign last year. So I just want to give a shout out again to this organization. I do want to talk a little bit about another challenge that I spent a lot of time focused on, and it's one that underpins the very foundations of our healthcare delivery system, and that's of trust. And its progressive erosion over the last many years. Listen, I don't need to tell anybody in the room what's happening. We are living through an epidemic of falsehoods that are transforming into a raging pandemic of its own type. Seemingly in just the last few weeks. I mean, it is overwhelming. Fluoride, then the MMR vaccine, then mRNA technology, not just for COVID, but for lung cancer. Don't understand how that makes a lot of sense for voters, regardless of your political ideology. Now we're talking about hepatitis B vaccine on Friday. The president said to move it from the birth dose to 12 years of age. Recommended separating The two-shot MMR vaccine in over 5 visits, so that means 3 fractional doses of the MMR vaccine across the country. And he was talking about Tylenol, again in that same social media post. We're talking here about a non-stop demoralizing trend of or falsehoods. And we often utilize misinformation or overuse that term, falsehoods. You know, study after study has found that individuals who consume misinformation on social media, especially during the pandemic, were actually more likely to die because they didn't get vaccinated. Very basic. And these effects were geographically concentrated. So we saw, and this is not here in the western side of Washington State, that these trends were seen. But that there was geographic distribution correlating with a higher COVID-19 mortality in some US counties. You know, this stuff is real. Has real impacts on humans, well beyond the noise it creates. We've seen it in vaccine hesitancy. We've seen it in climate denial and the anti-science rhetoric targeting public health officials, and too often in silence from those who know better. And I'll say it, like big business and like a lot of the corporate titans that are in our backyard, corporate America more broadly, they know better, they are staying silent. So here's my ask. We as healthcare providers, all of you are already in this breach, you're already filling the gap, you're here tonight. We're very grateful. But we have to further step into the breach. Because no one else is going to do it, clearly, even if they're equally, if not better positioned. And who's going to fill the gap when it comes to moral and humane leadership? Then everybody in this room, and your peers, and those that are following your footsteps, the younger generation, that lacks the mentorship, frankly, to feel like they have somebody to have their back, to be out there. It's lonely out there sometimes, advocating for what's right. We do not have a mentorship structure in place in academic medicine, if you ask me, to have these types of careers, where you can go speak truth, where you can go push back on social media, where you can do a media segment. Those things, generally speaking, over the course of one's training are not respected. We tend to favor medical communications in journals, not to the masses, and that needs to change. And so that's why I come to all of you and say, I know you don't need to hear this in this room, but I do believe our profession more broadly needs to hear this. We have to encourage current and future healthcare providers to communicate audibly and with clarity, not just, again, in medical journals, through the written word, and what's traditionally been accepted as impactful in academia, but in communities nationwide to help shape the public discourse. We must offer ourselves up as visible protectors of our neighborhoods, not just as healers of our patients. And we should get comfortable being uncomfortable. I really mean this. I can't tell you how many times I have young people in residency, just out of training, in pre-medicine, in pre-nursing, pre-pharmacy, you name it, across the board, saying, you know what? How do I go and advocate? How do I go and get my do thought leadership? How do I put myself out there? We need to be advocating and encouraging our trainees to advocate on social media in an authentic, evidence-based way. That's true to them. We need to be telling people to go speak on media platforms in a way that's, again, authentic to them, or to run for office. Or, what I'm doing a lot right now, and I'd love your help, is to mobilize through medical societies like the American Lung Association, ACOG, who's doing heroic work, the American Academy of Pediatrics doing incredible work right now under the scrutiny of this health secretary. They're taking dart after dart after dart, and they're standing up. Big ups to the American Academy of Pediatrics. We need to politically support. I know we all know this crisis is real. That's obvious to all of us in the room. That's why we're here. We're trying to support the Washington Physicians for Social Responsibility for a reason. This is not some sort of vacuum in which we're gathering here. There's a real problem right now. It's getting worse. And you know what? We are not spectators. Us healthcare providers, I'm going to broaden this to more than just physicians. Everybody here in the room, whether you're a physician or not, we are not spectators that are being asked to stay obediently in our lane. I can't tell you how many times I get trolled to stay in my lane from people. No, we're not going to stay in our lane. We are the stewards of science. We are the guardians of health, the storytellers who can remind the country what health justice looks like and why it's worth fighting for. In this moment, let us, in the spirit of this organization stand for a vision of medicine rooted not only in science and empathy delivered at the bedside, but in powerful evidence-based advocacy projected clearly and persuasively to the masses. This is the essential promise we made when we took the oath, especially for the healthcare providers in this room. Since the oath is constantly being questioned, we have a lot of people wearing the white coat, doing bad things, distorting what the oath and the white coat actually means. But this is the essential promise we made when we took the oath: to promote patient welfare, to protect our profession's ethics, and to spread knowledge and humility. That is the promise that this moment demands, and that is the promise we must keep. Thank you so much.